On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham. Thanks for joining us today. Here with us is Dr. Ramya Undamatla. She is a board-certified endocrinologist for Covenant Health, serving our patients over at Grace Clinic. Thank you for being here with us today.
Thank you for having me.
Absolutely. So we are excited about this topic because I think it has truly been one of the biggest conversations over the last year or two. Yeah. And not just on social media. Traditional media, conversations you have with your friends.
Yeah.
I personally know people who have chosen this route for weight loss. And so we want to dive into that rapid weight loss medication today. Let's start with the basics first. Why do so many women specifically struggle with their weight?
This is maybe more of a personal opinion, but I think personally a lot of it can be because we tend to prioritize other things. So we prioritize our family or prioritizing work. And there was a big meta-analysis, which was like a big study a few years ago that actually looked at metabolism rates. And we used to think, or a lot of people used to think that once you are in your 30s or your 40s, you're seeing a rapid decline in metabolism. And that's why we're seeing that weight gain that a lot of us see during that age period. But really, the studies showed that we don't see a very significant decline until age 60. But think about what your activity levels were during your college years, for example, versus maybe now or even 10 years from now. We were walking everywhere, probably in college. We were out late, we were doing all the things. And I think as we get into our late 20s, maybe early 30s, if you're married, you have children, you're settling down and you tend to be a lot more inactive just at baseline. And even for me, and what kind of it was very interesting for me to look at, because when we are in fellowship, you're in a big hospital, you are doing, tons of consults a day, you're getting easily, without even thinking about it, probably 15, 20,000 steps a day. And now I work at a clinic, and you go to your clinic and you see your patients. They're all, in rooms like right across from you. And if you are not intentional about it, you're getting maybe 2,000 steps a day, and that's it. And so looking back, you may have not changed anything in your diet, but that's a big activity drop from just 15,000 to maybe 2,000 steps a day. And that can be enough to cause weight gain, or at least make it much harder for you to lose weight. So I think a lot of it is unintentional, and we're, thinking about other things, and things are more important, which, to be fair, they may be. And I think a large portion of that is what's maybe driving the weight gain. I will say that there is definitely some influence of estrogen and progesterone, especially as we're getting older. We're seeing the decline in estrogen, and we've clearly seen that can result in more visceral fat, which is kind of the bad fat that you don't want around your organs, and you can lose muscle mass as well. And muscle is really important because the more muscle you have, the higher your metabolic rate is, or your rate of burning calories. So the more muscle you have, you're going to need more calories during the day, mostly. And if you are losing muscle, that's also giving, you're just not needing as much. And you may be eating the same, and it's just over what you're needing right now.
Okay, so maybe a real honest conversation with yourself about what the real problem is, because I feel like it is extremely easy just to be like, oh, it's my metabolism, without actually sitting there and going like, oh, I went from myself TV reporter job where I was running around lugging a camera every day to, guess what do I do now? I sit here and I talk forever. And so I'm not saying this is a problem I have, but but taking a real look at your lifestyle in general and understanding, is it truly a metabolism issue, or is it really like, no, you're just not moving around as much as you used to? Okay, that's a really good point to bring up. I'm glad we're starting the conversation this way. We kind of talked about this with other experts that we've had, but how do your hormones impact your weight, whether it's weight gain, weight loss, or weight management?
Yeah, the hormones are going to be a big part of all of this. So I would say I kind of would take it more individually. So if you are not making enough thyroid hormone, it can definitely lead to some weight gain. And if you're actually making too much thyroid hormone, the opposite is also true, and you can rapidly lose weight, and you may not be trying, and it may be unintentional. And that usually worries a lot of people, actually. Um, Uncontrolled blood sugars or diabetes, unfortunately, can also lead to weight loss. So a lot of patients will come in and, they may have been overweight and they've lost weight, and they say, I've lost all this weight. I'm not understanding why my blood sugars are still uncontrolled. And unfortunately, it's because the blood sugars are uncontrolled that you're losing weight, whether it's because you're losing a lot of water. And again, your muscles is, you're losing muscle at that point. So it's not healthy weight loss that we're looking at. It's just unhealthy weight loss. And then cortisol, if it's truly an issue, can definitely lead to a lot of weight gain that is unintentional. In that case, you really may be doing everything exactly as before, and you're just seeing weight gain without realizing it. And I had a patient last year, actually, that came in, and came in with her husband, and she was miserable because she worked out 3 or 4 times a week. She was actually tracking her calories. Her husband was like a personal trainer, so he really was tracking her calories and helping her track calories very accurately. And she just gained 30 pounds over the past year with no really known cause or issue. And she was, and when something like that happens, it's a red flag for us. So we did test her for cortisol issues, and she ended up having a pituitary issue, which is, a little gland in your head that was making too much cortisol. And we got rid of that, and so she is now losing weight. So I mean, sometimes it truly is a hormone issue, and most of the time, most endocrinologists are pretty happy to test that for you, because we understand too that it can be hard to know, are you eating exactly what you were eating before? Are you moving the same way? And it's very frustrating for patients, and we truly understand that. So we're happy to help you in any way we can. And I will usually, test for thyroid issues pretty regularly. It's a very easy screening test to do. I think with cortisol, because you see more false positives, which basically means you see an abnormal value and maybe nothing is going on, you do need to be a little bit more nuanced so that you're not worrying patients and checking things that come back abnormal, and then what are we doing with those lab values? But once you're seeing patients for a long period of time as, endocrinologist, you kind of get a sense of which patients may need to be tested, I think. And that's helpful. And so that you're not testing everyone that walks in your office. But those kind of things can definitely give us more of a, hey, that doesn't sound exactly right. And we can easily test for those things.
So you mentioned some like underlying health issues that could cause someone to gain weight, but what are some health risks people can face if they are overweight?
So the big ones that we think about are, it can increase your risk for high blood pressure, it can increase your risk for diabetes, and all of those things are unfortunately going to increase your risk for heart disease. And there is definitely evidence just being overweight or obese can increase your overall risk for mortality and how early you may pass away and with what medical conditions. So it is very important to try to find the underlying cause and treat the issue at as best as we can. But it's a sensitive topic, and I always wait for patients to bring up their weight to me, because it's not my job to come in and say, hey, you're overweight, you're obese, we need to do something about this right now. I need patients to want to talk about it first, and they're going to open up to us better that way. If, is something concerning that we're looking at and you're starting to develop pre-diabetes or blood pressure issues, it's something that we want to ask, are you okay talking about your weight today? And that's kind of how we want to start the conversation, to make sure that they're comfortable with you already, and they want to help, they want to help themselves, I'm sure. That's how I approach it anyway. So
That's a good approach, because it's like one of those, always that thought process is like, you can't help somebody who doesn't want to be helped or doesn't want that kind of help. And
Yes,
so
yes.
your advice may fall on deaf ears anyways. And
Right,
so,
right.
okay. So let's talk about GLP-1s. They were not originally used for weight loss. They were made or developed to help another condition. So let's talk about at first, what are they? How do they work? And what were they originally used for?
So the GLP-1 medications, they've been in the media now, maybe like you were saying, over the past 1 or 2 years, but we have been using them for over 10 years. And we primarily were using them for patients with type 2 diabetes because it really, really, and it still really does help get your blood sugars down. Now, they have a lot of ways that they work, but the main reason that we see, an improvement in blood sugar and now weight loss is because they work both on the gut and they also work on, your brain or your central nervous system. So they do tend to decrease your appetite. And a big thing that a lot of patients are talking about these days, and it's in the media now too, is kind of blocking out that food noise, right? So a lot of patients who are overweight or who've been overweight their whole life, they talk about food noise, which is basically this constant need or you know, urge to think about food or, have food around them or eat. And a lot of patients say as soon as they start a GLP-1 medication, there's a lowering of that food noise. Some people say it's completely shut off. So they are now able to eat as much as they want and as they need, and then they can stop, which is great. Now, I think what we had noticed as we were using it for patients with type 2 diabetes is that these patients were losing weight. And so whenever something like that happens, the pharmaceutical companies obviously jump on it and they want to, one, obviously help more patients and hopefully, use that in more patient population. But two, it's obviously going to make a lot of money. Let's be real, which is a big issue too with the cost of the GLP medications, which we can talk about a little bit later. But they've been around for a really long time, which is nice because a lot of our concerns for our patient concerns are, they're so new. How do we know they're safe? And, the truth of the matter is they're really not that new. They've been around for over 10 years. We've used them for a long time, different forms and different medications, but they're all essentially in the same class. So we as endocrinologists feel very comfortable using them. And if you are going to start something like that, I would find someone who's very comfortable prescribing them and dealing with the side effects that come with those medications.
Let's talk about those side effects since you mentioned them, because I feel like some people are like, yeah, I had none. And some people are like, I was nauseous for 3 months. And that's why I didn't eat, because I just didn't feel like, which as someone who's been pregnant and was very sick, trust me, I'm like, that was horrible. I can't imagine doing that. But also at the same time, you just told us how risky it could be to be overweight. And so, yeah, I don't want to die at an early age. That may be worth the risk, but we've heard about a lot of side effects. So what are those side effects of this medication?
So the most common side effects that we see would be stomach related. So you can, like you're saying, have nausea. In severe cases that can lead to vomiting. Some patients can have either constipation or diarrhea, just depending on the medication and how they're responding to it. The other big thing, especially if you're using it in patients with diabetes, is low blood sugar. So the medication by itself really does not cause low blood sugar, but if you're on other medications that can cause low blood sugar, you need to adjust those medications. The other things that we can see are, things like headache. That again is not really a side effect of the medication. It's more from dehydration, because, yes, you're not feeling as hungry, but because of that, you may also not be drinking as much water or hydrating as well. And that's a big issue that we see. And a lot of times that's all, you kind of just need to educate people. And as soon as they start bumping up their water intake, even if you're not feeling thirsty, just make sure you're sipping on something throughout the day. That really helps with the headache. So,
okay.
So who is a good candidate for these GLP-1 medications and who should maybe not take them?
So the patients, the American Diabetes Association actually changed, or let's say revised some of the guidelines recently. But most patients who have type 2 diabetes, if they're able to tolerate this medication, should be on this medication, or at least that should be a conversation that they should have with their healthcare provider. And if they don't want to be on the medication, absolutely, it's always a conversation, but it's definitely something that at least should be discussed. And the other reason for that is, apart from just the blood sugar control, we have other benefits now that we're seeing with these medications. And some of that is heart benefits, kidney protection. There's recently even some evidence that it helps fatty liver disease. And since our patients with diabetes already are predisposed to fatty liver, that's a big indication that we are really looking at. As to who should not be using the medications, really the two main contraindications as by the companies are if you have a history of pancreatitis, which is basically an inflammation of the pancreas. They don't recommend using these medications. And number two is if you have a very specific type of thyroid cancer, which is called medullary cancer of thyroid. And that's something you definitely want to discuss with your healthcare provider because it's not all thyroid cancers, and that specific type of thyroid cancer is actually very rare. And it's also not contraindicated if you just have general thyroid issues or even if you have little growths on your thyroid, which we call thyroid nodules. That is all fine to use these medications. But if you specifically have a history or a family history of this specific thyroid cancer, we don't recommend using that medication. But really, those are the two big contraindications. Everyone else, definitely a conversation to be had, depending on your medical conditions and things like that. I would also probably say most physicians are maybe a little bit more hesitant to use it in transplant patients just because it's a transplant and you just want to be really careful. But in that case, it's, you really want to make sure it's a coordinated effort. Talk to all the providers involved, make sure everyone's aware of it, and make sure things are being monitored very closely.
So before this, I think there were really only a couple of ways you could have this major weight loss, and it didn't happen very rapidly. It's diet and exercise adjustments or bariatric surgery. Obviously, I can see why someone chooses a medication over surgery. Also, the fact that, again, diet and exercise may take you 2 years to do what this medication does in just a couple of months. So what are the benefits, but then also what are the risks of major and rapid weight loss?
I'm glad you brought up diet and exercise. So I think the problem with diet and exercise is it is a fundamental aspect of weight loss, and it's kind of where we're starting with, right? The problem is that there's so many other factors that are influencing your weight, whether that's environmental, your genetics, things that are that you are influenced by. You look at on TV or social media, and your body, unfortunately, most of the time is not helping you. It is working against you in terms of weight loss. So a lot of our patients who are starting these medications may have already tried every diet and all. And the big issue is that you may lose the weight, but weight regain is also very common. Even with these medications on board, unfortunately. So I think that's where these GLP-1 medications really play a big role now, because we have something that we can use that really helps all those aspects of it all at once, which is great. And really, we see a significant weight loss with these medications. There are going to be downsides. And I think the downsides are that because they're so common now and they are used so commonly, everyone is prescribing them, and people that may not be necessarily trained are prescribing them. So you don't want to start these medications and then you see, like, say, a 30-pound weight loss in 1 month and you're happy about it. But, the question is, what did you lose in that 1 month? And the answer probably is you lost a lot of muscle in that 1 month. And that's not what we're looking at. We're looking at really hoping to lose the fat and the bad fat, quote unquote. So I think you need to make sure that when you're using these medications, it's a gradual weight loss. We're not looking for rapid weight loss. And sometimes those conversations are hard to have with your patients because they are looking maybe sometimes for rapid weight loss. But I think you need to be very clear up front, what the expectations are and how quickly or safely they can lose this weight. When we see rapid weight loss, the problem also is that weight regain can also be just as quick. So we want to make sure that we're doing it in a more sustainable way. And I think as long as you are on board with your provider, you are already, have the diet and the exercise, you have that down pat. That's a great place to start with GLP-1 medications. And it can be a coordinated effort, and it should be a coordinated effort with not only your physician, but, a registered dietitian, possibly a personal trainer, whatever you need to make sure that you are consuming enough protein, consuming enough nutrients, and getting exercise done as well. Because if we're not also complementing the GLP-1 medications with all of that, it's going to be much harder to sustain that weight loss, especially if, you would ever have to come off the medication for any reason.
Do you prescribe it often for patients that aren't diabetic?
Yes, actually. Yes.
Okay.
I mean, as long as their insurance covers it,
You
absolutely. Like,
Okay.
I will say, like, I'm probably because I've had some people who are just like, okay, I'm getting married next month and I just want to lose like 10 pounds. And I'm like, okay, but this is not how we want it to be.
Yeah.
And it's not we try not to use it for what we call quote unquote vanity weight loss. Because yes, if you need to lose 5, 10 pounds, but you're metabolically healthy, and it's just for the purpose of aesthetics. Not that that's a bad thing. And, everyone is wanting to achieve that. I'm a little bit more hesitant to do it that way and for that reason.
That's fair.
Yeah.
But yeah.
I have a question that kind of goes back a little bit, but so the purpose of it is for diabetic patients to regulate their blood sugar.
Right.
If you're someone who doesn't have diabetes is
Mhm.
taking it, can it negatively impact their blood sugar?
Usually, no, actually. So the great thing about these medications is they really start to exert their effect on the blood sugar if your blood sugar is high. So if you have a normal blood sugar, it's very rare they would drop your blood sugar or give you a low blood sugar unless you are not eating consistently. And so that's another reason you may want to check in and see if maybe you need to lower your dose if you are having those issues. Because, if you're not eating at least 2 to 3 meals a day, getting enough nutrients, getting enough carbohydrates, it can lower your blood sugar, but it's rare for most patients. So.
How long does someone take? I'm sure it has to do with the goal, whether it's diabetes or if it's weight loss. But since the majority of our conversation today is around weight loss, I'm assuming somebody who has 100 pounds to lose is going to take it longer than someone who has 30 pounds to lose. But how do you know when you're good and when you stop?
So medically, about a 5 to 10% of your body weight is when we really start to see improvements in terms of heart health or blood pressure, diabetes, whatever that may be. If you are looking for more weight loss than that, we're happy to continue the medication and adjust it appropriately. Usually, I would say about 0.5 to 1 pound per week is what we're kind of looking at. And if you're losing more weight than that, it may be time to kind of reassess, see if we need to pull back on the medication, lower the dose. And if you're not losing that much weight, again, we start to look at other things that may be contributing to weight gain. So we try to think about these medications as more long-term medications. So think about it as something like you're using blood pressure medications for blood pressure, but when you come off those medications, your blood pressure is going to go back up. So don't think of it as, you're going to use it for 3 to 6 months and then stop the medication. It's more of a lifestyle, change that you're making. And so you're hopefully going to continue on them long term. You can definitely adjust the dose down, decrease it as your feeling is necessary. But a lot of our patients do need to stay on the medication longer term to maintain that weight loss. A lot of times when we stop the medication, you do see weight regain. So, I mean, that's something you can definitely adjust after you talk with your provider. You can also stop the medication, kind of see and assess how you're doing. And then if you do start to see that weight creep back up and you feel like, okay, I do want to get back on the medication, we can always do that also.
Why are these GLP medications so expensive? You kind of touched on it earlier, and obviously it's supply and demand. We understand
Right.
business, okay? So they're the hot thing right now. People know that they work, so they want them, so they can price it this high. But for a patient who actually needs it, is it covered by insurance?
So a lot of our patients with type 2 diabetes, yes, I would say. Again, depending on your deductible, your price may still be high, unfortunately. But for a lot of our patients with type 2 diabetes, yes, they're going to be covered because we have very good evidence for them and we've been using them for a really long time. Now, if you do not have diabetes and you are using it for weight loss without that diagnosis, it does become a little bit harder for insurance to cover it. And a lot of it can also depend on your employer and if your employer covers weight loss medication in general. And I think a lot of this goes back to still, we still have that stigma of weight gain and obesity and how people should just be able to exercise and eat less and walk more and lose the weight. And I think hopefully that's changing now. But I think from that practice or that issue, a lot of providers don't cover these medications, or a lot of employers don't cover these medications. And it's funny because I think in the long run, if you're looking at just cost, if you do cover these medications and you help these patients lose weight, you may be preventing so many other complications that they could develop that you are then probably going to have to pay for to take care of the diabetes or high blood pressure and all these other medications. I will say that they are working on getting the prices down. Even I would say as early as like last year, I think it was about $1,200 for most of the GLP-1 medications for 1 month supply. And that's now about half. So you can get tirzepatide for about $350 to $600 right now per month, depending on the dose. And for semaglutide, which is Ozempic, quote unquote, is about $499 per month right now. So they're coming down, and we're hopefully going to see even more of a decrease, and that would hopefully make this more accessible to a larger patient population. But I think it'll be slow, maybe in the next couple of years.
Speaking of them being so expensive, I feel like you hear stuff about like people getting from different countries or like getting different versions of them. How do you know, or do you have any advice for like what is safe?
So, I mean, if you're getting the branded medications from another country, however you're doing that, those are going to be safe because they're just branded medications. It's just that, for better or worse, they may be cheaper in other countries. And if you are getting the non-branded medication, which we're calling them compounded medication, it becomes much more of an issue because we really have no way to regulate that. And so it's based on your pharmacy, based on who's making it. And one, they may not be effective, and they may not be as effective as the branded medications. And two, they may not be as safe. And we've definitely seen or heard of some horror stories where people have been hospitalized or even died from these compounded medications just because it's much harder to know what we're putting in those. So I would say, as a rule, I don't prescribe any compounded medications. It depends, it varies based on healthcare providers. That's just how I practice, and I don't recommend them. If someone is coming to me on the compounded medication, we have that discussion, and if they're comfortable continuing it with their provider, that's really up to them. But yeah.
This is not an ad because I don't want it to be an ad. I'm not endorsing one or the other, but you do hear about whether it's the brand name Ozempic, Wegovy, whatever, and then you hear about Zepbound, tirzepatide, whatever you just said, that I probably am not pronouncing correctly. How do you know which one is right for you or which one you should be taking?
So the two main ones that I think most of us are prescribing now are the once weekly injections, and we really just have two of those. One is tirzepatide and one is semaglutide. Now, tirzepatide has two brand names. One is Mounjaro and one is Zepbound, and they're the exact same medication. It's just that the indications, like how you can get them approved, are different. And what I mean by that is Mounjaro is used for our patients with type 2 diabetes, and Zepbound is used in patients who do not have type 2 diabetes, but we're using it for obesity or being overweight. And the same is also true for semaglutide, which is Ozempic, or the other brand name is Wegovy. So Ozempic is for our patients with type 2 diabetes, and Wegovy is for our patients without type 2 diabetes, but they are the exact same medication. Now, choosing between these two medications really does depend on, unfortunately, one, what your insurance covers, and then two, some people just tolerate one better than the other, and that definitely plays into it. And then three, the tirzepatide or the Mounjaro Zepbound does tend to give us a little bit more weight loss than Ozempic or semaglutide or Wegovy. So if patients have tried Ozempic or semaglutide and they still haven't lost the amount of weight that they are wanting to lose, then we may switch them over to tirzepatide to see if we can get some more weight loss.
My husband's a pharmacist, and in the pharmacy, they all listen to this podcast, and I think this is going to be a very fascinating episode for them. Because like you, they have been giving people these medications for years for diabetes or whatever, and then it all shifted. But he had a very similar mindset. We had a big conversation about it, because again, I don't understand. I'm not a provider, but he's like, do you get how much weight really impacts everything? And I think the more we've done this podcast, the more we realize, whether it's your brain health, your heart health, your lung health, everything has to do with weight. It is so impactful. And even just our daily movements and functions. So it's just fascinating. So,
and I will also say that I think finally this year, I've seen some data that say that we're maybe finally, stopping the trend up in obesity or, weight. And a large portion of it is probably due to these GLP-1 medications.
Wow.
So they're definitely making a difference, even on, the grand scale or the big scale. So, yeah.
And it's not unusual for a medication to be developed for one thing and then used
Yeah.
for another thing later on.
Yes, for sure. And, it's very funny because you'll kind of see it in our clinic day to day because, you'll say, okay, what are you using this for? And maybe it's something like gabapentin. And then they're like, well, what do we use that for? And then I have to be like, well, it can be for these 4 different things. I'm not sure which one you're using it for. And so you kind of have to list all of them out. So yeah, it's fairly common for that to happen. I think these took off so much because, like you said, weight is such a big problem in the country right now. And we finally have something that's making such a big difference.
Is there anything else about these medications that you think people should know?
Yes, I just know that these have been around for a really long time. I know a lot of people are worried about the long-term, side effects and what we don't know about these medications. But we know more than you may think. So I do think they are usually very safe for most patients to take, unless you have some kind of health condition that precludes you from taking it. And then I would really encourage you when you start these medications to really look also at your lifestyle and make sure we're doing all the other things that we recommend, even when you're not on these medications, so that you're getting the best out of these medications. And the other thing I would also say is if you are, having issues with coverage. I know it can be tempting to go the compounded medication route. Just know that they come with their own set of issues or problems. So it's just something to be wary of. And, you need to make that decision with being fully informed of those risks. So,
I have one more question.
sure.
Since this is a female podcast, we talk about pregnancy a lot. You hear things like Ozempic baby or like it's bad to get pregnant when you're
Yes.
taking this medication. Can you talk about that a little bit?
Yes.
Question.
Yeah, a great question because it is really important. So we have seen that, these medications may improve or if to put it in a very simple term, I guess, make you maybe more fertile. And because they do probably help, polycystic ovarian syndrome and things like that. And we know classically that a lot of those patients suffer from infertility or issues with getting pregnant. These medications are not recommended for use during pregnancy. We just don't have any data about them, or even if you're breastfeeding. So usually what we tell our patients is about 2 months before you think you are wanting to start trying to conceive, we need to stop the medications, and get them out of your system, and then we can resume them after you're done breastfeeding and you've delivered your baby. So.
All right, it's time for our trending topic. So let's shake it up and see what you're here to talk about today.
All right. Using ChatGPT to meal prep and to get an exercise routine. Honestly, I don't think it's a bad idea. If you're really struggling, it's a great place to start. I have not tried it myself, but I do have other people who've tried it and said they've gotten pretty good results. I will say, just talking about meal prepping briefly, it is one of the most important things that I recommend our patients do, especially if you have type 2 diabetes or you are on a weight loss journey. The simple fact is that most of us are very busy, and we, if you come home and you have nothing prepped in your fridge or in your house, the probability of you opening DoorDash or some other app and just getting something delivered is probably high. And I think the big thing also is that people feel like they need to meal prep whole meals. And I would recommend just if you're starting out, just prep a protein, just prep some healthy fats, just prep some grains of some sort. And you can always use those in different meals. And that way you don't get bored and you still are meal prepping and you're still eating what you want to be eating, but you have much more variety and much more options. For exercise routines, I may be a little bit more careful with that using ChatGPT just because it may not know where you're starting from, what limitations you may have. I think if you are truly trying to like weight lift or resistance train and you are starting from zero, I would recommend highly for the first 1 to 3 months getting, to see a certified personal trainer, some kind of professional to make sure you are doing that safely. And then after that, I think you're good to follow a program. I would also, once you've done that initial, I would say training, I also don't recommend just walking in and doing random exercises. Try to follow like a workout program. There's so many online. Most of them are actually great. You can even get some free ones, but trying to hit all the muscle groups that you need to be hitting is important. And if you're just kind of doing random exercises, you may not get the results that you're hoping for. So I may be a little bit more cautious with the exercise part of it, but I think for meal prepping, it's a great option.
Everyone needs a little inspiration every once in a while.
Yes.
So why not ChatGPT, I guess.
Yep.
So, well, thank you so much for joining us again today and helping us understand these medications more and the benefit and risks of them. If you obviously have questions, please go to your doctor. But follow us also on anywhere you can get your podcasts. Ask us questions on Instagram, Facebook, whatever. And we will see you next time.
This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.